Hi, my name is Dr. Ross Hauser. I'm Medical Director of Caring Medical and Rehabilitation Services here in Oak Park. We're actually in one of the exam rooms in our office. We have a young athlete here. She's volunteering her hip. She actually has what's called snapping hip. So basically what that means is that when this athlete, externally rotates her hip, there's actually a snapping sensation here, like there's a clicking, grinding, popping there. So people can feel it. Sometimes you feel it on the side here. So she could go like this. For her, there's not a clicking, popping sensation on the side here. It's actually in the front here. So snapping hip syndrome means that there's too much mobility in the hip. She actually has hip instability. And that hip instability is causing a rubbing. For her, it's in the iliopsoas muscle, but sometimes you can get it, the snapping, clicking sensation in the muscles that attach here. So the muscles that attach here are the gluteus medius. So the gluteus medius attaches right on the greater trochanter. This is the greater trochanter. And then you have the iliotibial band. So the main treatment for snapping hip syndrome often is physical therapy to stretch the iliotibial band or to stretch the iliopsoas muscle. But again, if it's not getting resolved, what does that mean? It means that the underlying cause of the iliotibial band tightness or the cause of the iliopsoas muscle tightness is not getting addressed. And it makes the most amount of sense that the actual cause of it isn't the iliotibial band or the iliopsoas muscle, but actually the underlying joint instability. If the person has a hip ligament injury in the back or a hip ligament or labral injury in the front of the hip joint's going to move too much. And what that's going to cause is your greater trochanter is going to be moving. So when this athlete runs or walks up and down stairs, all of a sudden the greater trochanter's moving too much. So obviously anything that goes over it, including the bursa, can get irritated. So the bursa is a fluid-filled sac that runs between the bone and the structures that go over the bone. In other words, so there's not friction. So the main structure that goes over this bone is the iliotibial band. So if somebody has tenderness on the greater trochanter, which is right here, so if somebody has pain like right there, or they have a bursitis, or the doctor said you had a tendinitis here, or you have iliotibial band syndrome, they should think, I probably need prolotherapy to get at the root cause of the problem, which is joint instability. So think about the person who has joint instability. This is moving too much. It irritates the bursa, so you get a bursitis, or it irritates the iliotibial band. If you get a steroid shot, that's not going to cure the problem. You may feel better. I don't think that's a good treatment because you're going to feel better, then you're going to go out and run and think everything's okay. Well, everything's not okay because you got joint instability. If you got joint instability and then you can't feel that, like, I'm hurting myself, I'm hurting myself, I'm hurting myself. That's what pain is, right? When you're an athlete and you have pain, it's like you're hurting yourself, you're hurting yourself, you're hurting yourself. So it would make no sense to keep doing that. So imagine if you had like Novocaine on your finger and you stick it in a fire. Oh, everything's fine, like I can't feel it. Like that doesn't make any sense. Like you're gonna lose your finger. Like how do people lose joints? Like is there a mystery? Like all of a sudden you get hip arthritis? Like you're 45 and then we have 45-year-olds, 42-year-olds, 37-year-olds. The youngest person we ever had where the person got a hip replacement was like 19. I'm just telling you, like there's an insatiable appetite by orthopedic surgeons to want to do hip replacements. So I'm just saying you should get at the root cause of the problem. If you take anti-inflammatories or get cortisone shots to get rid of your pain, the underlying problem's still there. So you're like the person who has their hand or their finger, it's all Novocaine, and they stick it into a fire and it's burning up, or you're destroying it because you're playing tennis. You're doing all this stuff, and you're not allowing the body to feel the injury. So don't do that. The good thing about prolotherapy to get rid of the joint instability is it doesn't cover up the pain, it resolves the cause of the pain. Now, there's a muscle that basically originates here. Ooh, you're a little bit tender there. Then it attaches here. That's called the gluteus medius muscle. The gluteus minimus muscle goes like from here to the side to the front of the greater trochanter. So sometimes there's muscle attachments. There's muscle attachments that are tender. Muscle attachments, tendon attachments, and ligament attachments are called entheses. You'll see the word enthesopathy. So prolotherapy is, anyone who follows prolotherapy, and all prolotherapy is an injection technique that stimulates the repair of ligaments, tendons, cartilage, meniscus, labrum, and entheses. So enthesopathy just means that there's an injury or a weakness of where the muscles, ligaments, tendons attach to the bone. And prolotherapy is done where? It's done where the ligaments, tendons attach to the bone. Ligaments, tendons, and muscles attach to the bone. So if you have an enthesopathy, like in other words, you have where a ligament, tendon, or muscle attaches to the bone, prolotherapy is going to be a really, really good treatment. So if somebody's been told they got a gluteus minimus tear, which would be over here, gluteus medius tear, or tendinosis of the gluteus medius or gluteus minimus, you know, prolotherapy is going to be a really great treatment. Tendinosis means degenerated tendon. So anything that's degenerated, what does a degenerated joint need or a degenerated tendon need? It needs regeneration. Another name for prolotherapy is regenerative injection therapy because it regenerates the structure. It stimulates the cells that make the ligaments, make the muscles, make the cartilage, make the meniscus to proliferate. Then they make more of those structures. Those structures get strong. You know, the hip joint doesn't move excessively. The greater trochanter doesn't move excessively. Then there's no irritation of the bursa, so the bursitis goes away because you get at the root cause of the problem. The iliotibial band has plenty of room. It doesn't get irritated. So thus the pain goes away. So anyone with lateral hip pain, you know, prolotherapy is going to be a great treatment.